My name is Tushar Patel. I'm a plastic and reconstructive surgeon here at the Institute of Advanced Reconstruction. I see patients in our Edison, East Brunswick, and Shrewsbury offices in New Jersey. So abdominal wall reconstruction is a generic term where we reconstruct or repair the abdominal wall. The reason we do that are multi-layered, multifactorial. It could be from having previous surgeries where you develop a hernia, which is essentially a hole in the strength layer of the abdomen, which we call the abdominal fascia. It could be from having previous surgeries such as breast reconstruction that are not really related directly to abdominal wall, but have some sequela from the donor site where the tissue is taken to reconstruct the breast. It could be as simple as just fixing the fascia, making it stronger, doing a repair. Sometimes we use synthetic materials such as meshes. Sometimes we use biologic materials that are different types of meshes. And then we also have a very innovative way of reconstructing abdominal wall with the lowest recurrences that we developed here at the Institute of Advanced Reconstruction. We call that the bars technique, where it's bony anchoring fixation to the pelvic bone and the hip bones, which gives actually a great result, great abdominal contour with the least amount of recurrence rates. The abdominal reconstruction surgeries, now they're different for every patient. The ones that are not as involved, they're smaller hernias, don't need as much work done. They typically last about an hour and a half to 2 hours. And oftentimes we can do them even in an outpatient setting and do a 23-hour stay and send the patient home the next morning. Some are more complex cases, which requires the component separations, putting in mesh, maybe anchoring the mesh to the bone. We typically do those surgeries in the hospital. They can take anywhere between 3 to 4 hours. And most patients will spend about 2 or 3 days in the hospital for recovery. Recovery is different for every patient, but on average, you're looking at a 4 to 6 week recovery period. We want all our patients to be ambulatory and walking from day one. So in the house, they can walk in the house, go to the bathroom, they can go up and down stairs, obviously slowly and with some help the first couple of days. And then after about 3 or 4 days, they can walk outside. No running, no exercise, no lifting more than 10 pounds for at least 6 weeks, sometimes 8 weeks, depending on the type of abdominal wall reconstruction that's done. I would have to say on average, with our more advanced reconstructive abdominal walls, we have probably a 95 to 98% non-recurrence rate, so about 2 or 3%, less than 5 for sure, of having a recurrent hernia down the line.